Hello everyone, my name is Pharmacist Michael. Have you taken XANAX in the past? Are you taking it now? Is it your security blanket for anxiety? You know, XANAX was the first medication I took for my panic attacks back in the late 80s. Back then, most doctors had no idea what panic disorder even was. The only SSRI available at the time was Prozac, and it was used for depression. I carried XANAX around with me for years, even after I stopped taking it, just because I knew if I ever did have a panic attack, it would make it go away. But is it safe? What are the risks of taking XANAX? Are there better options? I will answer these questions and more in this video, so get ready to learn more about XANAX. Alprazolam or XANAX is a short-acting benzodiazepine used primarily for anxiety. It can also be used for sleep, but there are certainly better options. Let's save the first question, is XANAX safe, for later in this video. Let's start with the risks of taking XANAX. Unfortunately, there are several risks associated with XANAX. First of all, it can be very addictive, and drug dependence can result especially in those with an addictive personality. If this medication is taken over time and suddenly stopped, withdrawal symptoms can result, including seizures, that may be life-threatening. XANAX can also lead to sleep-related activities such as sleep driving, eating, and cooking. Yes, this isn't only related to Ambien. XANAX can also make depression worse and increase suicidal ideation in some patients. We also think long-term use of benzodiazepines in general may predispose patients to dementia later in life. Besides long-term effects, some side effects can occur early in treatment. These include shortness of breath, confusion, memory problems, blurred vision, urinary retention, dizziness, drowsiness, headache, and trouble speaking. It is extremely important that you know how XANAX affects you before driving, operating dangerous machinery, or making important decisions. I can tell you that when I first took it, it knocked me out. XANAX can also be very dangerous when mixed with other central nervous system depressants such as alcohol, opiates, barbiturates, anti-seizure medications, and other benzodiazepines. If you are taking any other medications, be sure your physician is aware of these prior to taking XANAX. Are there better options for sleep or anxiety? The answer is yes and yes. First of all, XANAX should never be used for sleep. I have uploaded a video on this very subject on this channel, and we'll place a link to it in the description section below. As far as anxiety, non-drug options should always be tried first. These include meditation, deep breathing exercises, the tapping method, guided imagery, yoga, tai chi, mindfulness exercises, psychotherapy, and regular exercise. Avoid illicit drugs and alcohol, and be sure to eat a healthy diet consisting mostly of whole foods. Yes, this really does matter. If you must use medications, hydroxyzine is a good option for breakthrough anxiety attacks, and SSRIs and buspirone can be used for long-term treatment. There is also a book called Feeling Good that was written by a psychiatrist that can really help. I have placed a link to this book in the description section as well. This book has really helped me, and if you read it and do the exercises, I believe it can help you too. There are also nutritional supplements that are known to help some people with anxiety. So here comes the big question. Is XANAX safe? It can be if it's used properly. For short-term relief of debilitating panic attacks, it is very effective. The problem is, you have to be careful with other drugs, and if you are prone to addiction, it probably isn't a great choice. I know a lot about anxiety, both on a personal and professional level. What I can tell you is I was able to cure myself with non-drug treatments. I believe the secret is learning how to get your mind off of the physiological changes occurring in your body during the panic attack. This takes practice, and there is no perfect solution for everyone. XANAX can be a great short-term tool in the treatment of panic disorder and anxiety, but it comes with a cost. If you want to learn more about psychiatric disorders, medications, nutritional supplements, and disease states, please subscribe to this channel. I post 3 videos each week on these very subjects. If you know anyone who might benefit from this video, please send it to them. If you have any questions, feel free to reach out. I'm always happy to help. My name is Pharmacist Michael. Be happy and be healthy.